Welcome, everyone, to our first podcast from the Healthcare and Life Sciences Council of the Greater New Haven Chamber. My name is Eric Thompson. I am the chair of the council, and today I am extremely excited to bring to the audience a topic that is so important. And if we look at measurably improving the health and well-being of our communities and a dive into our federally qualified health centers, there are so many resources available to folks here in Connecticut and abroad that we're just not aware of. And so today we have the experts in the room to talk about this. So why don't I turn to each of you to introduce yourself, and then let's dig right into it. So maybe, Deb, you can go first.
Sure. Thank you so much. My name is Deb Polun. I'm the Chief Strategy Officer of the Community Health Center Association of Connecticut.
And hi, Eric.
Hi, Michael. Good to see you.
I am Michael Taylor. I am the president and CEO of the Cornell Scott Hill Health Center based in New Haven, Connecticut.
And we're fortunate enough on our council to have Dr. Tech having been part of the council for a long time. And so I thank you for taking, both of you, the time to come here today. So let's just get, straight out in the, of the gates here and say, what is a federally qualified health center?
You don't know?
Well, I do.
A federally qualified health center is the closest thing that you're going to see anywhere to a group practice primary care center. Federally qualified health centers typically offer primary medical services, dental services, and behavioral health. Their evolution in terms of each of those lines of business and expansions of those services vary from one organization to another, but basically we're primary care practices, but much broader.
Right. And then when we look across Connecticut, I'm going to come back to you on this, Michael, but Deb, how many of these centers do we have here in Connecticut?
We have 17 federally qualified health center organizations in Connecticut, and each of them have many sites available for people to access services. So, for example, Michael's organization, Cornell Scott Hill, based in New Haven, but how many sites do you have?
35.
35 places for people to access
to get care.
services.
Yeah.
Medical, dental, behavioral
Medical,
health,
dental,
some
behavioral
specialty
health.
care as
And
well.
we have a lot of specialty care as well.
Right. So when you say specialty care, expand on that.
That could mean ophthalmology. That could mean dermatology. That could mean, what else do we offer? Orthopedics. It could be eye, ear, and ENT. Broad range of services.
So this is a really special thing that people can go in and they can get their primary medical care, dental and behavioral health, usually all in the same building, sometimes specialty care, like Michael said, and it's for all ages. So if you're a parent and you have kids and maybe you have a parent yourself that you're also helping to manage the care, all of you can receive care from the same organization in the same building.
And what's one of the other benefits is that all of those services are on the same electronic health record platform. So it makes it easier for us as an organization to coordinate all the services that are being provided for patients. So you don't have to go from one place to another to have all of your care needs met.
And your providers are talking to each other.
Right. That's one of the biggest
colleagues.
challenges, right? That's the biggest challenge we have in our healthcare delivery system is, my information's everywhere and I'm spending a lot of time trying to coordinate that or figure out, what prescriptions need to get refilled or what have you. I think, so when I look at how many people are getting served here in Connecticut, I don't know if we have a number. I think I saw a number out there of over close to 500,000 people in Connecticut use federally qualified health centers.
It's 452,000, so you're right on track.
I wasn't going to quote that, but I did look at your website, and you said I'm responsible for the website, so thank you for that.
So 1 out of every 8 people. And across the country, there are about 32 million people in America who use a federally qualified health center for their care.
So then when we look at people that are using federally qualified health center, in my role as a benefit broker consultant here in Connecticut, trying to create programs that employers can offer to their employees, we are always struggling with cost of care, deductibles, cost of insurance, We have within employer populations, we'll have Medicare, individuals. We'll have Medicaid folks that are on Husky, and then we'll have people that have in the same population that also have the commercial insurance. You guys serve all populations.
Everyone.
Everyone.
We serve everyone. And so, I've been involved with the Greater New Haven Chamber for years.
Wonderful.
And one of my reasons for wanting to be in that forum is so that the employers, local employers, would know that we're the ones who take care of their workforce. We're the ones that enable them to build their businesses on healthy, engaged people.
Well, and that's ultimately what led to this today. This podcast was our council is very hands-on active and wanting to improve access to care by educating the population, both within the chamber community and abroad. And so let's talk a little bit about, you have, Michael, over 30 locations.
We do. We have 22 school-based health centers. We have become quite a significant organization now, serving 60,000 patients per year, just coincidentally. Last year, we just got finished one of our federal reports, and we now know that last year we rendered more than 400,000 visits to our 60,000 patients. We have now been in existence in 2 years. We'll be 60 years old, so we've been around for a while.
Right.
And we have grown quite considerably over that 60 years. Such that there are 750 staff members at the Cornell Scott Hill Health Center. We are as much a provider of behavioral health services as we are medical and medical specialty services. We are a teaching health center. As we manage Yale New Haven Hospital's teaching clinics in internal medicine and women's health services. So it's become quite a significant organization.
So, thank you for that. So then when we look at across the state, all the great work that Michael and his team are doing, what do the other, when you look at your role as the association, what are you working on with not only the FQHCs here, federally qualified health centers here in Connecticut, but abroad? What's your marching orders? What do you have to do?
We bring the health centers together here in Connecticut. Michael's on our board, along with the other CEOs of the other health centers in Connecticut. And we bring them together for education sessions, technical assistance. Our association is really striving to ensure that the health centers in Connecticut are financially stable and providing the very best care that they can. So another big part of that is working on public policy and advocating for what it takes for health centers to continue to provide their services to the people who need them. And that's on the state level, on the federal level, occasionally on the local level. We're bringing the voices forward of health center leaders and their patients to ensure that policymakers are helping to meet their needs, whether that's through ensuring that Medicaid rates are high enough to support continuing to provide services to Medicaid enrollees, or ensuring that that other programs are in place that will provide the wraparound services and all of the support services that health centers provide to their patients.
And I have to say kudos to CHC Act because they've been really outstanding in supporting the state's community health centers for the past many years.
Yeah, that's wonderful. Yeah, because when we look at, again, there may be 17 organizations delivering, so many visits and, 452,000 patients, but you guys also have to work together. Just like when we look at, the names that many folks in Connecticut would recognize, Yale, Hartford Healthcare, UConn Med Center, you guys are right there too, because it's all about how do we deliver care and work together regardless.
Yeah, I mean, we are partnerships.
Right.
And Yale New Haven Hospital is certainly one of our partners. We have many because we can't be all things to all people. And we try not to recreate what already exists. We'd love to partner and do partner with many organizations to make sure that care is offered in the most comprehensive way, in the most convenient way and accessible way for the communities we serve.
So what happens, I'm someone that, right now we know the uninsured population has spiked. And not only, it's one thing to say uninsured has spiked, but clarity and understanding what I have for coverage, whether it be Medicaid, Medicare, or commercial insurance. When I come into a health center, let's say I don't have any insurance, what happens?
Not a problem is the easy answer, because we are the recipient of a federal grant that enables us to subsidize the cost of care for patients who are underinsured and uninsured. So someone who meets the criteria could come in and see one of our providers, who are extraordinary, by the way, for as little as $20 per visit.
Yeah, so all of the federally qualified health centers are charged by federal law to serve all people in their area. So if you come in and you're uninsured, the health center will see you as a patient, like Michael indicated, put you on a sliding fee scale based on your income, and then they will refer you to one of their enrollment specialists who are on site to see if you might be eligible for either Husky or a commercial plan through Access Health CT. And they can help you get enrolled right there that same day.
And that's a great point, because a lot of people come in and they are uninsured, but they are eligible but unaware of their eligibility.
Right.
So we work with them to get them enrolled.
I have to just shout out that your health center has some very long-time enrollment specialists.
It is true.
And who come in with literally decades of experience helping people get enrolled in our state Medicaid program, which we call Husky, and now in the last 11, 12 years in Access Health CT.
Well, and I think this is what I say, when we're meeting with employees of companies, do not be ashamed or hesitate to ask any and all questions, because this stuff is so complicated. And to miss cues on, I was supposed to go and do this, or I was supposed to go do that relative to applying for Husky, or, a disruption in coverage or what have you, lean on people. And that's without a doubt, when I think of the federally qualified health centers, that is at the foundation.
I would add too, but you're leaning on people who really have expertise in these areas. So as Deb indicated, we have staff members who've been doing eligibility work and helping our customers for years, 20 and 30 years. These folks really know what they're doing.
Right.
And a lot of the staff members at health centers are from the communities. And so they literally speak the language of their patients. So if you come in, English isn't your first language, or you have low literacy, or you have trouble using a computer, don't feel comfortable, they're going to help you get the services you need and help you get enrolled and figure out what other services you might be eligible for as well.
Well, and I think when I look at here in Connecticut, and I'm sure it's the same outside of Connecticut, but like Michael, if I look at, who you are and what you stand for, that's the tenor of the federally qualified health centers. Like, we have to help the person.
Correct.
Versus we have to do so many visits, we have to get so many patients seen. That's not it at all.
And help the person regardless of the circumstances and that they bring to us. As we talked about earlier, we serve everyone. People who are uninsured, people who are on Medicaid or Husky in Connecticut, people who are commercially insured, Medicare patients, people in Medicare Advantage programs. We serve everyone.
Well, and again, working with employers and employees of companies, I can tell you that those that I have educated and my team has educated on federally qualified, there have been many times where they come back and say, I'm so thankful that you did that, because it was such a great experience where I could actually go there and get stuff done, not do it in an urgency and not feel like I couldn't afford it. So you talked about sliding scale based on income. Can you just dive into that for the audience for a second?
Sure. So every federally qualified health center has a board of directors. The board of directors, and this is in federal law, more than half of the board of directors must be patients of the health center. And so they truly are rooted in their communities and governed by people who are going to be using their services. The board of directors each year has to set a scale, a sliding fee scale for customers to use who come in who are uninsured or underinsured. And underinsured could be you have a commercial plan with a $3,000 deductible. And you're going to have to pay out of pocket for certain visits and so forth. And that sliding fee scale is then incorporated on the front desk people are the very first people you see, and they're going to help make sure that you get access to the services that you need at a price that you can afford. And if you can't afford it, they're not going to turn you away either.
Right. And they're not going to hit you with a $180,000 bill.
No, we don't do that.
That we hear about. I think what I also, we were talking earlier before we started recording, but last night 60 Minutes did an article on remote area medical, which is ramusa.org. They're in about 19 states, not Connecticut, but in the end, they're creating the pop-up, 1 day, 2 day, 3 day clinics, primarily dental, vision, and a little bit of medical. When I say a little bit of medical, it's because the stat I believe they used, Scott Pelley used, was 95% are non-medical visits, and people will show up 4 days in advance because there's a limit on how many patients can be seen, and they'll sit in their cars waiting for, dentures and eye exams and so on. And Deb, we were talking about earlier the mission of mercy, but and I want you to talk about that, but also getting back, and we've said it a few times, talk about why people don't need to wait to go get care.
Because we're there all the time.
Right.
We've been in place for 58 years now, and serving fourth-generation families.
And you see everyone.
Everyone.
Yeah, we do have the annual Mission of Mercy dental clinic here in Connecticut. It's actually coming up in a couple of weeks, I think April 17th and 18th in stores. And this is a wonderful service that is provided by volunteer dentists and lots of volunteers every single year. And people wait in line for many hours. The weather in April is... it could be anything,
iffy.
Right? It's very iffy.
Iffy.
That's a good
It's
way
New
to put
England.
It could be cold and rainy, or hot and sunny while people are waiting for these services. And it is a good clinic, but we really want to make sure that people know you don't have to wait in line like that in order to get dental care. You can call your local community health center and make an appointment for dental care. You don't have to have dental insurance. You don't have to have comprehensive dental insurance. And our health centers are going to see you at a time that's convenient for you, where you don't have to wait in line with 1,000 other people waiting to get your annual visit.
Or in the elements of unpredictable New England springs.
Yes, you can wait inside our health center.
Well, and I think what we were talking about earlier too is it is a constant mission to try to best communicate and create awareness of what's available out there. And so that's part of what this podcast is to say, here's the awareness. We will see, I'll make sure that we put on the banners, how to access, the various health centers and the care that's needed. And then we didn't touch on it, but Michael, I want to come back and talk about what are you doing in the schools? Because federally qualified health centers live in some of the many of our schools here in Connecticut.
We at Cornell Scott have 22. I can't keep track anymore because the number keeps increasing. I think it's 22 or 23 school-based health centers where we offer the same complement of services, medical, dental, behavioral health services, in 22 schools in metropolitan Greater New Haven.
And this is an amazing convenience for parents and their children.
Really?
So if you think about anyone who's a parent out there, your kid has an appointment in the middle of the school day. If you are somebody who works, then you need to take time off from work, drive to pick up your kid, pull them out of school, bring them to the doctor's office, bring them back to the doctor, back to school, and then you go back to work. So a 30-minute doctor's appointment could take 2 hours or more of your time leaving work, and your child has missed maybe math, science class, or who knows. With the school-based health centers, like Michael has mentioned, they can walk down the hall during either recess or lunch or a free period and get that same service right on site. And because the parents have signed a form in the beginning of the year, they are approving the services that are being provided to their children and then being kept in the loop. So it's really an amazing convenience and providing the same type of care, the same quality of care that they would receive on site at a doctor's office.
And if we happen to be your child's primary care provider, that those services that are provided in the schools are entered into the same record as your child would see when they come into one of our care sites.
Wonderful.
So it's seamless care.
Yeah, and this is not your school nurse's office.
No.
You know, when you
Right.
think about, oh, I have a headache or a fever or my belly hurts, you're going to go to your school nurse's office. This is your school physical, your weekly behavioral health visit.
Right.
That's super convenient.
Some kids are these days are on medications. It's medication management as well for the kids
Right.
while they're in school.
And so now as we look to wrap up our time here today, let's talk about the importance of quality facilities and I'll turn to Michael, the resources you need for your clinicians to deliver this care. Tell me about what you have to focus on as an organization and also what your latest grand opening was.
For the past 8 to 10 years, we've been on a path of restoring, expanding, improving the infrastructure of all of our care sites. So I have to say, they're really beautiful. And I think competitive with anything that exists anywhere in any market. Patients are pleasantly surprised. One of the things that occurs to me as I say this is we are Joint Commission accredited, which is an accreditation body for healthcare organizations. And we had our Joint Commission surveyors come and visit with us last spring. And their comment was, I have never seen such a well-equipped primary care organization. And every community should have a Cornell Scott Hill Health Center. I'm biased, but I happen to agree.
I have seen many health centers around our state, and they are just beautiful. And it really shows the investment in our communities. So the Cornell Scott Hill Health Centers are all beautiful facilities, and then we have health centers that are up in the northwest corner of the state, the northeast corner of the state, all over every corner,
Right.
every big city, every small city, and some of the suburbs as well. And to invest in communities and to invest in people, to really show people that no matter who you are and how you're paying for healthcare, you deserve to have the highest quality place to receive care
And
the
providers.
highest quality providers.
And resources. So you asked about our most recent project that we completed, because I think we've completed one a year for the past several years. The most recent one that we opened early last year was our Recovery and Wellness Center, which provides 52 beds of shelter housing for people in substance use, with substance use and mental health issues. And that's now busier than it opened, and 6 months later, it's full.
Right. An underserved need that we have here.
Absolutely underserved.
So in the end, you're doing something about it instead of talking about it.
Well, we certainly try. That's
Yes.
why we exist.
Well, I think as we come to a close here, I want to again thank both of you for giving the audience, a really good deep dive quickly into what's available for resources, the high quality care, high quality facilities, ease of using the system. And through the statewide association, Deb, you and your team, and obviously, Michael, you're part of that too, are working here in Connecticut to continue to do our best to provide high-quality care to anyone that needs it.
Yeah, thank you for the opportunity to talk about it, because we do feel like, unfortunately, we're the best kept secret in Connecticut, and we don't want to be the best kept
Right.
secret. We want people to know you probably have a health center in your community, and it's easy to find them. You just go to our website, www.chcact.org, and you click Find a Health Center.
And then for Michael, for your website,
www.cornellscott.org. We're very easy to reach. 203-503-3000.
there we go. Well, wonderful. As we now are in just past, a little bit past Easter, and we're coming into the spring. By the time this is released, we'll have some leaves on the trees. And I want to thank all of you and keep up the great work. And thanks for coming in today. And on behalf of our
pleasure.
Healthcare and Life Sciences Council, critically important for us to get this message out. So thank you.
Thank you so much.
Remember your community health center.